everyone, welcome to episode 3 of the Shannon Show. Today I am going to be talking about one of my most common in-office procedures called Ultherapy and answering the top questions that I get asked by patients. Ultherapy is a non-surgical skin tightening treatment. It is used on the face, neck, and chest. We used ultrasound to deliver heat energy to various depths of tissue. So we use our 3 different depths here. I always treat with 2, sometimes 3 depths, depending on the treatment area. So we get deeper and superficial tightening. Once the results kick in, most people notice a smoother, tighter, more lifted look to the treatment area, as well as less craviness and improvement to fine lines. Results are seen in the first about 2 to 3 months after the treatment, and then they build for the first 6. So at 6 months out, you should have basically your full result, and then they last about 1.5 years to 2 years after that. And usually in that time period, only 1 treatment is needed. The number 1 most common area that I treat is the submentum, or under the chin, to improve the look of a double chin or the lines that people get when they turn their head. Other than that, my kind of secondary most common treatments are the lower face, full neck, or the brows. Yes, it can. Our most common treatment that we do with Ultherapy is neck liposuction or submental liposuction. So we'll do the lipo and then a few months later do the Ultherapy treatment to tighten the skin in that area. We also can combine it with cool sculpting if the patient is a candidate, and we can also combine it with our injectables, so Sculptra or filler, to augment any areas of volume loss after the Ultherapy treatment. Ultherapy is very tolerable if you take ibuprofen, Tylenol, and Halcyon. Halcyon is a form of oral sedation, so we do that for almost all of our patients. Some patients decline the Halcyon, which is fine, and they get through the treatment without any issues. But most of the time the discomfort is dependent on the treatment area, as well as if we combine different treatments to make it a longer appointment. I love that Ultherapy is very easy, it's very safe and effective, and it's great for so many different ages. It's also wonderful if someone doesn't want a surgical intervention or doesn't need a surgical intervention. This is a great treatment for them. It's non-invasive, there's no needles, no knives, no downtime. So I think that's the best part, is that you just get to move on with your day right after the treatment, and you don't have to think about it after that. This is basically Ultherapy in a nutshell. These are the most common questions we get asked about it, and we would love to see you in for a consultation if it's something you're interested in.